There is a saying in English, people say ignorance is bliss. And I know of many people, if I try to tell them anything about COVID, they said, "Oh, I'm very scared, please don't tell me. I would rather be not knowing." How can that be? Hello there, I'm Dr. Purnendu Roy. I'm a surgeon in Genesis Hospital. After recovering from COVID and the episode that I spoke about how I survived COVID, it's not that getting an RT-PCR negative. Are we aware and spreading the knowledge that what is post-COVID syndrome, which is called long haulers? How long should you be careful? It's not to scare you people. Knowledge is necessary, and that's why today we are going to talk about all the complications, system by system, that can affect after recovering from COVID. Yes, when I got discharged from the hospital, out of that place, came home, took pictures, yes man, I've beaten the virus. I was feeling mentally strong. But I was wobbly in my feet, and then I realized that this virus drains everything from you. This virus affects your cardiovascular system, respiratory system, kidney, excretory system, neurological system, brain, cognitive functions, fogging, thinking. I have started working. I have started my chamber. Already after coming out, within 1 week, I have started operating, and I have already operated more than 50-60 patients in last couple of days. So I did not face any of the neurological or other things. Very close friend of mine, mid-50s, recovered from COVID, started working, complained one day of severe pain abdomen, was taken to a local place from one hospital to the other. Before reaching, dropped dead. People just feel sad, take him to the burning hut and burn. It's all over. There are people who are dropping dead below 40. There are 2 doctors, as I said in the last episode, that they are dropping dead with viral myocarditis, dropping dead with cerebral hemorrhage. I'm not trying to scare you. We need to find an answer to this. There was a study which was conducted in UK when I was doing my FRCS called CEPOD, Confidential Inquiry into Peri-Operative Death. When we started laparoscopic surgery, I remember clearly nobody was trying to describe and document the deaths or the major complications that happened. I still remember in one of the national conference, I insisted that we should show videos of complications of laparoscopic surgery, because unless we show, we will not learn how we are making mistakes. We were only seeing success stories. So now, after insisting, because people said it will bring disrepute to the procedure of laparoscopy, but I insisted that I want to show all the complications that happened in my hand. And it is not a disgrace, because people do understand that complications do take place. And so now in every national and international conference, there is a separate session, disasters in surgery. So that's the reason why I want to start a particular group, maybe a particular website where everybody should start reporting all the post-COVID deaths that are happening. And if we do inquiry into this, then we will be able to do a meta-analysis and our understanding will improve. So let's try and accept we still do not know what's happening. Unfortunately, nobody knows who are the people who are going to develop this post-COVID or what we call long haulers. But it is known that elderly people are usually at a higher risk, and also people with comorbidity, which means diabetes, hypertension, heart disease, or any other associated disease, they are likely to develop problems. So let's take one at a time. Basically, COVID-19 is a respiratory entry virus. Primary site of attack is the lungs, and even after they recover, many people are now complaining about breathlessness. So when we talk about respiratory system, what exactly happens? This virus which has attacked the alveoli and damaged these areas, and then when it starts healing, it causes fibrosis. Now this fibrosis causes difficulty and defective oxygenation of the blood. So these areas where there is thin alveolar lining, where exchange of oxygen takes place between the blood and the air that we breathe in, that doesn't happen. So the oxygen saturation starts dropping. And when the oxygen is down, then what happens? Then you start feeling breathlessness. So the people after recovering who continue to cough, continue to feel breathless, they have to be assessed by doing HRCT. The other mechanism of lung damage is pulmonary thromboembolism. Let us not forget that one of the main pathophysiology of the damage in COVID is the microvasculature, where clot forms, and these clots go and block certain arteries, and that's why the areas are damaged, and these areas of the lung cannot actually oxygenate the blood. So that's the reason why anticoagulation to keep the blood thin, that is taken. So what do we do? How do we recognize? Pulse oximeter. Even if you have recovered, it can happen up to 3 to 6 months. Check your oxygen saturation. If your oxygen saturation is not good, please get in touch with the doctors, and that's the reason post-COVID rehabilitation unit is necessary. So what do we all can do? Number one, after recovering, one should do incentive spirometry. We can see there are 3 balls over here, and you take this and you blow out and then take the breath in to raise all the ball. The second is vapor. You know, like when we used to get sinusitis, we used to take vapor. Now this vapor cleans up the clogging. You can take boiling water in a bowl, or we have vaporizer machines where you can put a eucalyptus capsule over there, and this cleans up. This is a vaporizer. It is connected to the electrical plug. Very simple. There is water inside. You can put an eucalyptus capsule inside, and either you can cover it up with your towel and just take the steam. The steam goes inside and clears the clogging and thick secretion. So you take the steam like that. People who are still getting spasm, if there are people who have got wheeze and breathing difficulty, either they can take inhaler, which is a puff, or it can be taken with a spinhaler. And here what happens is you just attach the puff over here and connect it in the mouth, take the puff and take it in, because children sometimes can't do it, and you take the whole thing inside. Or you can do nebulization. Doing nebulization at home is very simple. You don't need to go to the hospital, because the nebulizer, which is a portable nebulizer, is very simple. It costs 3,000 to 4,000 rupees. It's just plugged to the electrical socket. You put the medicine, Duolin or Butacort, and you just start off with the mask like this, and next, what is the other organ that can get affected. It's a cardiovascular system. If the lung becomes stiff and the lung can't oxygenate, who pumps the blood into the lung? It's the heart which pumps the blood into the lung to get it oxygenated. And if the lung becomes stiff and fibrous, then there is a more pressure on the heart, and that's called cor pulmonale. So they can show heart failure. The second thing it has shown, that post-COVID recovery period, many people can have inflammation in their heart muscles, and that's called viral myocarditis. Unfortunately, there are young people who have recovered from COVID and just dropped dead from myocardial injuries post-viral myocarditis. There can be thromboembolic phenomenon where clots are formed and thrown into the circulation. And these clots can go into different parts through the artery. People have had complete gangrene gut. You know what's gangrene? A clot goes and blocks the artery, so the intestine don't get blood supply. It just dies dead. It can reach up to the periphery in the limb. And if the limb artery gets blocked, you get gangrene of the limb. People have lost their limbs also in this. It can go thromboembolic phenomenon into the cerebral circulation, and there it can block off an area and you can get stroke. It can also cause hemorrhage inside, and that's called cerebral hemorrhage, and people have dropped dead from cerebral hemorrhage and stroke. This virus, unlike many others, don't restrict in one place. It just goes to every place. It has gone and affected the central nervous system. So now there are people who are showing different types of manifestations about poor cognitive ability, loss of memory, complete paralytic episode, feeling of weakness below the limbs, features suggestive of encephalitis-like syndrome. So not only just central nervous system, it goes and damages the kidney too. It has been shown that it can go and attach to the renal cells. It can replicate over there and damage the tissue. It can cause microemboli and block intrarenal kidney filtration systems and damage the kidney. There are people who have needed dialysis after recovering even from COVID because their kidneys are damaged. So now after getting discharged, took care of it. Many people think, and they keep on telling, doctors only give advice, they don't take care of themselves. No, I was doing everything. I actually continued with the anticoagulant and gradually stopped it. The steroid which I started off with 60 milligrams prednisolone intravenous 3 times a day, which means 180 milligrams, I tapered it off. Then 5 days for 40 milligrams, then 5 days for 30, then 5 days for 20. I'm still on steroid, tapering it off. I'm checking every day regularly my blood sugar, blood pressure, and just to let you know, 3 days back, I went and did a MRI angiogram of my heart, brain, and carotid Doppler. Why? Because I want to be sure that all my vessels, my heart and brain and everything is fine. It's the post-COVID period which is dangerous because we still do not know what all this virus can do, how to handle this virus, how long, when to do the next chest HRCT. There is still a lot to learn. How can we learn? We can learn only if we can become careful. We are not only talking about mask, sanitization and physical distancing. That's the only thing that we can do to prevent them from entering. But once it has entered and you have won it, now is the time when the post-COVID time. This period after recovering, not only following doctor's advice, you need to be on high protein diet because you have lost muscle mass, you are weak, and that's why I am on protein supplement, taking organic food, no junk food now. So in case if you need more advice, please like, share, subscribe, tell your friends, let everybody know about post-COVID syndrome, which is called long haulers. People, if you are reluctant to go to the hospital again, thinking you might get infection again because your immunity is not going to be long for 6 months or a year. It has been shown the antibody disappears after 1-2 months. So where should you go? Genesis is a non-COVID hospital. If you want to consult what to do after recovering from COVID, please ring, book your appointment in this number to know more about post-COVID management. So in conclusion, if you have recovered from COVID, the fight and war is not over. Stay safe. Don't go around because you can get COVID again. There are so many people who have got second and third infection. Eat proper food. Follow the advice of the doctor. Attend post-COVID follow-up clinic. One should do checkup of all this. Your lungs, your kidneys, your bloods, and your heart, how they are functioning. Tell people. Send your comments to me. Write to us. Then only we can gather more information. Let's do meta-analysis. Let's spread the news around. Thank you very much.